What is bipolar depression? In its simplest form, bipolar depression is defined as an imbalance in brain chemistry causing extreme emotional highs and lows in a person. This disorder is a chronic, lifelong illness, and when untreated, it can make it difficult for the patient to lead a normal life. While there is no known cure for this illness, taking proper medication, along with participating in psychotherapy, can effectively manage the symptoms. What causes bipolar depression? Unfortunately, bipolar depression is an illness that has no one known cause or cure, and it can affect anyone. There is no exact science to break down the whats and whys of the disorder. Research and studies have shown that a combination of genetics, family history, environment, physical health, brain chemistry, and personality can all play a role in why someone may be bipolar. Of these causes, genetic and hereditary influences are shown to be the biggest ones. Symptoms of bipolar depression. Bipolar depression is characterized by a shift between two extreme episodes, manic, high point, and depressive, low point, lasting anywhere from 7 days to several months, and in some cases years. It's important to note, there is no predictable pattern to the shift between these moods. Some of the symptoms to watch out during a manic episode are the following. Displaying overly exuberant or reckless behavior, i.e., spending a lot of money, behaving in a promiscuous manner, talking too fast and too much about different, unrelated things, heightened sense of touch or smell, a sudden extreme spike in energy and activity level, problems with sleeping less than normal yet still feel energized. During a depressive episode, the following symptoms may be present. Feeling guilty, worthless, weepy or anxious. Becoming forgetful, or easily tired with very little energy. Loss of appetite and interest in people, activities or daily life. Deep depression and suicidal thoughts. Problems with sleeping, an increased need for sleep, or not being able to sleep at all. Sometimes some people also experience a mixed-featured episode. This means the person is going through a combination of symptoms from both manic and depressive episodes. For example, someone going through a mixed-feature episode may be feeling hopeless and depressed, but at the same time, they are behaving recklessly, i.e., having lots of sex or spending lots of money, and are full of energy. How is bipolar depression diagnosed? A doctor will typically conduct a physical exam to make sure there is nothing physically wrong, before referring the patient to a psychiatrist for proper diagnosis and treatment. A few bipolar depression tests and quizzes, such as the Mood Disorder Questionnaire and General Behavior Inventory, are available online as a way of self-testing. However, these tests are not medically valid, and it is strongly recommended that the patient seeks professional, medical help for a proper diagnosis. Bipolar depression is not something that will ever go away with time. In fact, the longer it's left untreated, the worse it gets. The change in episodes come faster and closer together and become more severe. What is the treatment for bipolar depression? A bipolar depression diagnosis can be difficult to come to terms with for the individual and their loved ones. But it is important to remember that people living with bipolar depression can go on to lead very healthy and productive lives, with timely intervention and proper diagnosis and treatment. The most common medications used to treat bipolar depression are mood stabilizers and antipsychotics. It is important to note that most antidepressants only make bipolar depression worse. In addition to receiving drug treatments, Individuals experiencing bipolar depression are strongly encouraged to seek therapy and counseling.